Acupuncture is my life. AcupunctureIsMyLife. Let us begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott, your host and educator from Acupuncture is My Life. Now, this week's episode's interesting case of the week covers a heavy portion of my patient base, which are patients who come in with lower back pain. Now, lower back pain is a highly subjective form of discomfort in the lower back, where one can have a sensation of pain on either the right, left, or center areas of the lower back within the 5 lumbar vertebrae. Now, when it comes to Chinese medicine, lower back pain is strongly influenced by the kidney due to the fact that the lower back area on the human body houses the kidneys. Now, lower back pain can be complicated, and its characteristics of pain can vary depending on the pathogenic factors involved. Some of the chief complaints in which I get vary between cold pain, burning pain, soreness, heaviness, distending pain, stabbing pain, spasmodic pain, dull pain, or pain that just simply includes numbness. Now, I've experienced cases where the patient's lower back pain radiates down as far as the person's toes. Now, one common factor among my patients are the fact that changes in weather does affect the levels of pain in which they experience. Now, the relevant diseases that tend to be related to lower back pain are rheumatoid spondylitis, herniated disc, lumbar vertebral tuberculosis, sprain of the lumbar ligament, strain of the lumbar muscle, glomerulonephritis, pyelitis, and prostatitis. Now, when it comes to Chinese medicine, kidney essence deficiency is the primary internal factor when it comes to lower back pain. And as a practitioner, I have to look for potential exterior pathogens. I have to strongly consider dampness because dampness tends to be a pathogen that's heavy in nature. Dampness can come in the form of cold damp or damp heat, whereby any form of dampness tends to obstruct the flow of qi and blood. I also have to consider qi stagnation and blood stasis as a result of some type of fall, strain, sprain, heavy lifting, or bad posture. Qi stagnation has a strong tendency to lead to blood stasis in the lower back, which produces lower backache. Now, when it comes to my interesting case of the week, my patient was diagnosed as having blood stasis in the lower back. He had a sharp, fixed lower back pain that would get worse in the later hours of the day, which would restrict his overall range of motion in the lower back area. Now, he'd stated when his wife would attempt to massage it, it would feel worse when she applied the slightest amount of pressure. Now, when asked as to when he began feeling this pain in his lower back, he stated it had occurred approximately a week ago while exercising. I noticed he had a purple tongue and his pulse was choppy. I therefore knew that I had to invigorate the flow of blood, transform stasis, and regulate the qi to alleviate his pain. Along with an herbal formula recommendation, I used a point prescription of bladder 23, bladder 40, governing vessel 3, governing vessel 26, and Yao Tang Shui, along with Ashi points on the lower lumbar region. I'd also recommended to my patient to use a heating pad when needed, whereby after just 3 treatments on 3 consecutive days with electric stimulation, my patient was just about pain-free. I suggested he continue to see me until his lower back pain is completely resolved. Now, there you have it, my interesting case of the week. And until next time, acupuncture is my life. What's yours?